Good afternoon. Thank you for joining the Fiscal Year 2018 Justice and Mental Health Collaboration Program Solicitation webinar. We have a lot of great speakers on the agenda for you today. We have two officials from the Department of Justice's Bureau of Justice Assistance. The first one is Maria Fryer, who's a policy advisor for substance abuse and mental health. There's also Nikisha Love, who's a policy advisor for the Justice and Mental Health Collaboration Program. We have Nicola or Nikki Smith-Key, who's a program manager for the law enforcement portfolio at the Council of State Governments Justice Center. I am Sarah Wurzberg. I'm a Deputy Program Director for Behavioral Health, also at the Council of State Governments Justice Center. And today we're lucky to have three grantees from the Justice and Mental Health Collaboration Program. They're going to tell you a little bit about why they applied for their specific grant categories, give a little information about their grant programs, and tips they might have for you for applying for the Justice and Mental Health Collaboration Program grant. So first we'll hear from Tiffany Russell, who's the Planning and Development Director, PIO, of the Office of the District Court Administrator in the Atlanta Judicial Circuit, which is the Superior Court of Fulton County, Georgia. She is a Justice and Mental Health Collaboration Program Category 1 grantee. We also have Casey Rain, who's a consultant and the lead for the San Joaquin County District Attorney's Office in California for their grant, which is a JMHCP Category 2 grant focused on strategic planning for law enforcement. And then we have Brooke O'Byrne, who's the Director of Court Services in the 6th Judicial District Court in Humboldt County, Nevada, who is currently a JMHCP Category 3 grantee focused on implementation and expansion. For the webinar today, we're going to begin with an overview of the Justice and Mental Health Collaboration Program, or as we will call it, JMHCP Grant Program. We're going to provide some additional award information details. Then we'll have Nikisha go over the budget and review criteria for the grant program. We'll have questions and answers. And as I mentioned, within the Justice and Mental Health Grant Program section, we'll have the grantees sharing a little bit more about their experiences. So I'm going to turn it over to Maria Fryer to talk a little bit more about the Bureau of Justice Assistance.
Great. Thanks, Sarah. Hello and good afternoon, everyone. My name is Maria Fryer, and I'm a policy advisor for the Substance Abuse and Mental Health in the Policy Office at the Bureau of Justice Assistance, or as we call it, BJA. At BJA, our mission is to help to make American communities safer by strengthening the nation's criminal justice system. Its grants, training, and technical assistance and policy development services to provide state, local, and tribal governments with the cutting-edge tools and best practices they need to reduce violent and drug-related crime, support law enforcement, and combat victimization. Thank you for joining the webinar on Fiscal Year 2018 Justice and Mental Health Collaboration Program Solicitation webinar. We are excited to have increased funding this year for all grant categories and the overall number of awards. We look forward to providing you information and reviewing your grant application. I will now turn things back over to Sarah, who will talk more about the Council of State Governments Justice Center.
Thank you, Maria. The Council of State Governments is a bipartisan policy solution organization dedicated to all three branches of government. They cover various policy issues, including healthcare and criminal justice, and then in the Justice Center, we focus on justice topics specifically. Within the Council of State Governments Justice Center, we have a couple of different portfolio areas. Myself and Nikki work in the Behavioral Health Division, which covers the intersection of behavioral health and criminal justice. Within this, we have a bunch of different projects. Also within the Council of State Governments Justice Center, we have Corrections and Reentry Division, which provides training and technical assistance to Second Chance Act grantees. And we also work on justice reinvestment initiatives across the country. Within the Behavioral Health Division, we've been lucky enough to be the sole technical assistance provider for the Justice and Mental Health Collaboration Program since it began. I'm going to turn it back over to Maria, who will talk a little bit more about the eligibility criteria for the JMHCP grant program.
Thanks, Sarah. So on eligibility, only one agency is responsible for the submission of the application in grants.gov. This lead agency must be a state agency, a unit of local government, or federally recognized Indian tribal government. Under this solicitation, only one application by any particular applicant entity will be considered. All other must be proposed as subrecipients or subgrantees. An entity may, however, be proposed as a subrecipient in more than one application. The applicant must be the entity that would have primary responsibility for carrying out the award, including administering the funding and managing the entire project. The state or unit of local government will need to be the applicant. The nonprofit entity would be the subrecipient. A criminal or juvenile justice agency is an agency of state or local government or its contracted agency that is responsible for detection, arrest, enforcement, prosecution, defense, adjudication, incarceration, probation, or parole relating to the violation of criminal laws of that state or local government. A mental health agency is an agency of state or local government or its contracted agency that is responsible for mental health services or co-occurring mental health and substance abuse services. A substance abuse agency is considered an eligible applicant if that agency provides services to individuals with co-occurring mental illness and substance abuse. So on to an overview of JMHCP. The focus of JMHCP is cross-system collaboration to improve responses and outcomes for people with mental illnesses and co-occurring substance abuse who come in contact with the justice system. The contact can be because a crime was committed, or law enforcement officers were first responders to a call involving a person with mental illness where no crime was committed. These service partnerships enhance and increase law enforcement responses to people with mental illnesses and co-occurring substance abuse, which supports public safety and violence reduction. For program-specific information, JMHCP seeks to increase public safety by facilitating collaboration among the criminal justice, mental health, and substance abuse treatment systems to increase access to mental health and other treatment services for individuals with mental illness or co-occurring mental illness substance abuse. JMHCP promotes officer and public safety through the coordination of system resources for people who are accessing multiple services, including hospital emergency departments, jails, and mental health crisis services, cross-discipline training for justice and treatment professionals, and facilitates communication, collaboration, and the delivery of support services among justice professionals and treatment and related services providers. There are 3 grant categories. Every applicant will need to choose a grant category. It's important to think through the which grant category can be most helpful to your jurisdiction in assisting with system coordination between criminal justice, mental health, and substance abuse treatment. Today, we are lucky to have 3 grantees who you will hear from during this webinar. They will describe why they decided to apply for the JMHCP grant category and provide tips that they wish they had known when they were putting their application together. After each one describes their category and their program, we'll get to hear from each one of them as we move through these categories. And again, as you see, the categories are Category 1, Collaborative County Approaches to Reducing the Prevalence of Individuals with Serious Mental Illness in Jail. Category 2, strategic planning for police and mental health collaboration. And Category 3, implementation and expansion. For each category, applications must include how the proposed program will address opioid abuse reduction. Where opioid abuse is not a current issue for jurisdictions, applications should provide how such a problem might be addressed in the future. So on to Category 1, collaborative county approaches. The collaborative county approaches is focused on increasing and maintaining jail capacity for violent offenders and the development of system-wide coordinated approaches to safely reducing the prevalence of non-criminal people with mental illnesses and co-occurring substance abuse in local jails. The Stepping Up Initiative is a national initiative to decrease the prevalence of serious mental illness in jails. This is a partnership between the Council of State Governments Justice Center, the National Association of Counties, the American Psychiatric Association Foundation, and BJA. The work under JMHCP Category 1 closely mirrors the Stepping Up process outlined in a document about the 6 questions county leaders need to ask. And the 6 questions are, is your leadership committed? Do you have timely screening and assessment? And before I continue, someone mind advancing the slide, please? Thank you. Do you have timely screening and assessment? Do you have baseline data? Have you conducted a comprehensive process analysis and service inventory? Have you prioritized policy, practice, and funding? And do you track progress? These 6 questions are part of what is addressed through the phases of this grant category. So back to Category 1 and the phases. Phase 1 is the planning phase of the grant. It is critical to make sure there is some baseline data information before moving towards implementation. The grantees have up to 8 months after receiving OJP budget approval and the use of up to $100,000 to receive intensive technical assistance, or TA as we call it. BJA's national TA provider is CSG, and they'll be assisting. They will follow the Category 1 Planning and Implementation Guide to assist in working through the planning process with you. Phase 2, after BJA approval of the Planning and Implementation Guide, the grantee will spend the remaining grant funds on directly related implementation activities. These activities will be informed by the information from the Planning and Implementation Guide. Next slide, please. Category 1, Phase 1, Deliverables. In Phase 1 of the grant program, there are several options for allowable activities. 1, establish a team or utilize a pre-existing team of county leaders, relevant stakeholders, and decision makers from multiple agencies to engage in the planning process. 2, develop a plan to conduct timely screening and assessments for mental illness and co-occurring mental illness substance abuse and for risk of recidivism. 3, establish baseline measurement of the number of people with mental illness and co-occurring mental illness substance abuse booked into jail, their average length of stay, percentage of people connected to treatment, and their recidivism rates. 4, conduct a comprehensive process analysis and inventory of services to determine existing policies, practices, programs, and treatments that exist, and identify service capacity and gaps, as well as evidence-based programs and practices. 5, prioritize policy, practice, and funding improvements, and estimate the impact of new strategies. And 6, establish a process for tracking the impact of the plan on the 4 key measures. And the 4 key measures are the number of people with mental illness booked into jail, their length of stay in jail, connections to treatment and recidivism. applicants may consider engaging with a research partner or an evaluator to ensure outcomes are being evaluated effectively. On this next slide outlines the 4 key measures we just described. And the last thing we want to mention before we turn it over to one of our current JMHCP grantees are these 4 key measurement outcomes. It's important to track progress for decreasing the prevalence of serious mental illnesses in jail. And while we can see this is like a really big task, it can be helpful to break it down further into these 4 key measures. Again, to reduce the number of people with mental illness in jail, to shorten the average length of stay, to increase the percentage of people with mental illness connected to the right services, and then lower the rate of recidivism. And now I'm pleased to hand it over to Ms. Tiffany Russell, Planning and Development Director, Office of the District Court Administrator, Atlanta Judicial Circuit, Superior Court of Fulton County. She is the lead in the FY16 JMHCP Category 1 grantee, Fulton County Superior Court in Georgia. Thank you so much for being here to share your experience with these potential applicants. Tiffany?
Hi, everyone. Hopefully you guys can hear me. My name is Tiffany Russell, and I'm with the Superior Court of Fulton County here in Atlanta, Georgia. And I just want to share a few things about our process to getting the Category 1 grant funding. So just a bit of background information. When I started working here in early 2014, our court had just adopted a strategic plan that was related to a lot of process improvements across the court. But one of the major pieces for that was we wanted to improve our interaction with people that suffered from mental illness and how they were handled here in our courts. And it wasn't just necessarily about specialized dockets and different things like that, but just how do we redirect them from being involved in our system in the beginning. And so what we did to really start looking at that process and that idea is we hosted a regional mental health and criminal justice symposium, mental health symposium, that was in 2015. And it was for, essentially when we first started, it was for 3 courts in Metro Atlanta, Fulton County, DeKalb County, and Clayton County. And then once people started hearing about the symposium, it quickly grew to a much, much larger event. And so it actually turned into a regional where we had cities from as far as South Georgia. We had someone who was interested in coming from out of state. But we really wanted to keep it with Metro Atlanta criminal justice partners, our jails, our law enforcement, and our county leaders to kind of really sit down and talk about the problems. And so we had this 2-day event where we just kind of talked about all of our issues, all of our pain points. And then we decided, well, what do we do now? Now that we know all of this information and now that we've started looking at all of these problems, what do we do with that? Luckily for us, one of our county commissioners, Joan Garner, who is no longer with us, was very active in NACO. And at that time, the Stepping Up initiative was just in the very beginning, and she was very involved in that. And so she brought that information to us, and she said, you know, I was attending the symposium, and I think that this project and this program could really be helpful in what we're trying to accomplish. And so Fulton County became a Stepping Up initiative county, and we adopted all of the principles of Stepping Up. And shortly thereafter, we found out about the grant. And so what we decided to do was just essentially take all of the work that we had done previously, apply it to Stepping Up, and then request funds for us to have someone help us put together a strategic plan on how do we move this forward. Fulton County is very large. It's very complicated. It's a very populated county within the city. We have 2 jails. We have a county jail that is handled for mostly felons, felony, and transfers to the prison system. And then you have our city jail, which handles traffic, misdemeanors, and then sometimes they're bound over to our Fulton County jail. But the city jail is handled by the city, and the county jail is handled by the county, and we are not consolidated. And so that was one big issue that we had to face fairly quickly. But what we decided to do when we were applying for the grant was that we knew we couldn't look at just one. We had to look at them both. But when we wrote the grant, because we were Fulton County, we knew that we could get the buy-in of the sheriff and the chief jailer. And so we partnered with the sheriff and the chief jailer in writing this particular grant application. And so we got support letters from several county elected officials, the DA, the public defender. We got support from our behavioral health providers, several community leaders, our hospital emergency room that handles a lot of drop-offs for those with mental illness being dropped off there by the police. We got some of the chief of police for the Fulton County at that time. And so we just had a lot of partnerships that were lined up when we were getting ready to start this application. And essentially our idea was that we would put together a task force of all of these leaders, all of these concerned leaders, that would come together and we would create a strategic plan for our county and how we would attack the large number of people coming into our jails. But one of the things that we knew we needed to really look at up front was the fact that we didn't have the numbers and the data to really support it because we weren't tracking it properly. We all tracked everything in different ways. We were all working in our own silos. We all had separate processes. And so we knew that that was going to be a major issue for us, and we addressed that in our application and said this is even more reason why we need funding so that someone can help us. And so when we sent in the application, what we asked for was funding for facilitation of this large group that would come together, that would create a plan, a strategic plan. But first we would have to do an inventory of the services and the gaps that we currently can recognize. And then we would put together an idea of how to collect the data that we needed to support what we found so that we would be able to show that we were using data and our decisions were being driven by data. And so moving forward, we would have the numbers that could support what we were asking for. And so what we first did when we got the funding was we hosted the sequential intercept mapping activity, which was the foundation of this grant for us. It was so important for us to bring all of those people together. We had about 50 people that attended, and they were so beneficial in helping us kind of see the collaborative that we had and all of the services and kind of asking questions that we would have never thought of on our own. And the information we gathered from the SIM workshop was the foundation for our work groups and the larger task force as a whole moving forward. And so what we did was we took those 5 work groups that we formed in the SIM workshop, and we decided that we would meet monthly with those work groups, and then we would also meet monthly as a large group where we would report out what we worked on in those larger groups. And then we would really just make sure that everything that we did was to develop recommendations for a strategic plan for us at the end of this grant period. To just give you some background on the task force, we have about 265 members of the task force. We have about 80 that attend regularly for our monthly events. and sometimes those other larger numbers come with the individual work groups, and towards the end, our work groups were actually starting to meet twice a month so that they could really tee up their recommendations and have everything that they needed when it was time to present to the larger group. We did that for about 9 months of meetings. In December, all 5 work groups presented at least 5 recommendations to the larger group, and then the larger group voted on priority for those 30 recommendations. And so we have 5 top recommendations that are super focused, and then there are other recommendations that some are already in action, some were just slight changes that needed to happen in our systems. But the top 5 recommendations were, as a group, we decided that these were the 5 things that we know we have to focus on in order to move this project along. One of them being we needed to put together a validated assessment tool in both jails, and it needed to be standardized for both jails so that they weren't different. That we needed to create a standardized data collection process so that we weren't working in silos and we were actually getting information that could be helpful to each other and our partners. We are also looking at ways to determine, as you're in jail, if you're an imminent risk for homelessness, and start that reentry process a lot quicker than you're going to get out tomorrow. We actually are going to start looking at the reentry process at the beginning when you're booked in. And so those recommendations, we've taken them, we voted on them, we've assessed them, and we took those recommendations back to our Board of Commissioners. We presented our plan to them, and they essentially have backed us in saying that they would support us financially and with resources, additional resources, with however we can get this process started. And so currently where we are right now, we have completed all of the requirements of Category 1, and right now we're working with the same facilitator that we used during the grant, and they are putting together implementation packages for us so that when we apply for the next phase of funding, we can not only tell you how much this would cost us, what this plan would look like, but that is for each of the top 5 recommendations that we have. We also have created, since we finished the planning of the project, we've also included some focus groups that would help us in the areas of strategy and outreach, and then also funding strategy, because we know that we can't rely solely on BJA and this grant funding to move this project along, but we'll also have to tap into private foundation funding. We'll also have to look into private partnerships. We'll also have to work specifically with our county and the state Department of Behavioral Health. And so we're looking at, as a group, we're looking at how we can get that done in a systematic way. Some important things that I think that we wanted to make sure that we thought were important for us is don't overlook the importance of the planning piece. I know that it can seem extremely tedious at times, and your team members and your partners can get really excited once you start talking about all of your problems and all of the ways that you can solve them, and they want to go right away, and they just want to implement something right away because that makes them feel like they're working. And we had the same problem, but we wanted to really make sure that we did not overlook the importance of planning and that we did not skip the foundation, because it was just so important to receive that technical assistance from CSG. They were so helpful to us in kind of keeping us on track and keeping us in line, and helping us with all of the information that we needed to put together. Be sure to use your planning and implementation guide. It is so helpful in addressing all of the gaps that you think you may have in your planning process. And it was really how we knew what we needed, and really that's essentially why we applied. We knew we needed technical support in order to have a broad systems change. We have, for several years, all of our partners have been trying to work in their own silo in getting things accomplished, and we weren't talking to each other, we weren't supporting each other, we weren't providing each other with information. And finally, with this particular project, we were able to get everyone on board and get everyone on the same mission and goals. And we have just really been powerful in the way that we've been able to get our processes together and getting the data that we needed, the training that we needed, focusing on the 4 key measures, and having to really drill that into everyone at every meeting, every work group meeting, every task force meeting. And the facilitators that we brought in kind of did all of that for us. They did all of that data collection, meeting facilitation, pulling everything together. They did the evaluation. They even set up a website for us, and our particular website is www.fultonstepsup.org, and you can see all of the work that we've done so far, pictures from our meetings, documents. Our final report is there. And so just all of these different things are available and helpful in getting this process accomplished. I think that's about everything that I had to talk about for right now, unless someone has a question. But again, just really wanting to focus on don't skip the planning process and that foundation of planning. It's so important, it's so imperative. And again, your partners will get so excited and they're going to want to start implementation, but if you can just keep them focused on that, the project will definitely be successful.
Great. Well, thank you again, Tiffany. That was such very helpful information, and just great to hear from you and hear about your experience and all the helpful tips. So we're going to go ahead and jump into Category 2. This grant category is focused on strategic planning for law enforcement agencies, specifically. And it follows the police mental health collaboration concept, or what we call PMHC. This category uses a planning guide similar to what Tiffany was describing for Category 1, but this planning guide is specific to Category 2, and it assists grantees in moving through this PMHC process. Upon receiving a grant award with the intensive technical assistance provided by BJA's National Training and Technical Assistance Provider, CSG Justice, to develop and document a police mental health collaboration using the Category 2 Strategic Planning Guide. The Category 2 Planning Guide will walk jurisdictions through building police mental health collaboration in their jurisdictions. Next slide. So the Police Mental Health Collaboration Framework is intended to assist local leaders, including elected officials, law enforcement, and behavioral health agency executives, and their senior personnel who want to begin or improve the outcomes of their police mental health collaborations by asking themselves the following 6 questions about their police mental health collaboration. Note that it's 6 questions again. You might notice that, and that these questions are being fine-tuned as we speak, so almost readily available for the field. You may be asking, what is a police mental health collaboration or PMHC framework? It is a way to break down the development of PMHC for jurisdictions. It involves, similarly to Category 1, 6 questions as well, to help jurisdictions examine their PMHC. And the 6 questions are, is our leadership committed to the police mental health collaboration? Are we following clear protocols to respond to people who have mental illness? Are we providing staff with quality mental health and de-escalation training? Do we have the resources and service connections for people who have mental illness? Do we collect and analyze data? Do we have a process for reviewing and improving performance? And as you can see, this takes this complex topic, breaks it down into leadership, protocols, training, resources, and services connections, as well as data and using that data to improve performance. Next slide. Category 2, deliverables. For this planning grant category, the deliverables are to establish an interagency work group including law enforcement, behavioral health, and all other major stakeholders such as 911 and dispatch, hospitals, courts, and corrections. This really reflects the goal of JMHCP grant program of justice and behavioral health collaboration. The next step, designate a law enforcement agency project coordinator in a position of authority to review data on performance and adherence to policies and procedures, ensure day-to-day operations are in line with the PMHC mission, and coordinate outreach engagement with other partners. We found that it's critical to have someone guiding the process to develop the PMHC, or a point person coordinator. Next step is to review and revise as needed existing protocols to respond to people who have mental illness or co-occurring mental illness and substance abuse, including interagency agreements, screening and guidance for mental health calls for service, and information sharing. These are all key areas through the planning process that many sites will be able to begin revising protocols, setting goals for the future areas they'd like to work on, and continuing to think about their process. The next step, to review and revise as needed again, existing and develop or revise as needed officer and call taker mental health and de-escalation training. Training is something that is a real focus for JMHCP. It is critical to give officers and others the information they need to help identify people with mental illnesses and make these critical connections. And we have a few more. To assess existing behavioral health resources such as a crisis hotline, mobile outreach, crisis facilities, outpatient treatment, and more. To identify gaps in service and prioritize behavioral health resources for PMHC. Knowing the gaps in the system and services is a key part of making a PMHC successful and gives jurisdictions the ability to prioritize behavioral health resources. Next step, assess ability to track mental health-related calls for service and dispositions. Repeat calls for the same individual, duration of calls for service, and develop additional capacity to analyze and track those calls. Develop a process for reviewing and improving performance data to promote additional PMHC capacity and long-term sustainability. And now I'm going to turn it over to Casey Rain, who is the lead for the Fiscal Year 17 JMHCP Category 2 grantee in San Joaquin County District Attorney's Office in California. This will be the second year for this grant, and we appreciate Casey sharing her team's experience so far. So welcome, Casey.
Thank you so much. So my name is Casey Rain, and I'm the president of Rain Community Development, and I have spent the past 10 years working to improve mental health and justice collaboration efforts in San Joaquin County, which is a mid-sized county of about 750,000 individuals in the heart of California's agricultural San Joaquin Valley. So I want to start by giving you a little background and history of how San Joaquin County started to strengthen their mental health and justice collaboration efforts. We did some initial planning as part of, under the auspices of the Mental Health Department in 2008 and 2009 to get stakeholder input, and we heard a lot about ways in which the Mental Health Department could improve countywide services, but we also heard a lot about uncomfortable interactions with law enforcement. And we also heard from our law enforcement partners that maybe they were having a hard time working with the mental health department in quite the way that they wanted. And so there was some back and forth and some discussions about, you know, where we could all do better work. And what it led to was a summit in 2010 where mental health leadership and law enforcement leadership from multiple departments, our sheriff, police officers, police chiefs, members of our court, the probation department, kind of sat down and started talking through a number of issues and made a commitment to begin working on them. And since that time, there have been a number of different ways in which that's happened through ongoing meetings with police chiefs, kind of a justice collaborative roundtable. But one of the things that really helped us was we applied for and received our first JMHCP planning grant in 2010. And during 2011, when we launched that planning grant, we used the sequential intercept mapping tool to determine the needs and gaps in our community. And we came up with a very, very long checklist of work that needed to be done. I'm pleased to report that a lot came out of that plan that we created. We applied for and received funding under the Second Chance Act to implement one of our core strategies to pilot a project in our San Joaquin County Jail to do reentry planning with transitional age youth who had mental illnesses. The results of that were fantastic. We actually trained correctional officers in motivational interviewing. We started doing reentry planning in a joint process between the probation department and mental health clinicians, and outcomes were really, really, really good for participants. And there was this other impact, which was on the unit in which those offenders were housed, those young transitional age youth with mental illnesses, we had trained the correctional officers in motivational interviewing. We found that incidents on the unit overall fell dramatically, not just amongst participants, but in anybody housed on that unit. So with that information, we actually applied for another Second Chance Act and were awarded funding to take that pilot project to scale throughout the jail. Many other things came out of that planning process. We significantly expanded our collaborative problem-solving courts, our mental health courts. We created an assessment center within the probation department where we were doing uniform screening for mental illnesses. We have launched and are in the process of implementing uniform screening and reentry planning in the jails. We just started a justice decriminalization unit within our mental health department. We now have mobile crisis support teams. We have mental health liaisons within our largest police departments, and we produce regular ongoing mental health 101 training for law enforcement officers. In other words, we've done a lot of collaborative work, and it all came out of that first JMHCP planning process that we started in 2010. Our relationships are much better between law enforcement and the mental health department, and there's significantly less finger pointing. But after about 7 years, we've checked off many of the things on our to-do list. And we looked around, and it was obvious that there was a lot more needed to prevent entry into the criminal justice system. Along the road of doing all that work, we became a Stepping Up Initiative county. And we really wanted to do more to prevent entry of people with serious mental illnesses into the criminal justice system. So what did we do? We decided to reapply for a JMHCP grant, of course. So why does anyone decide to apply for a JMHCP grant? And I have to say to all 390 of you who are on this call right now, being on this call means that you are very curious. Maybe you've done this before, but it also puts you in a very elite cadre of communities that are committed to making change. I have some good news for you. It's worth it. And I have some bad news for you. These JMHCP grants come with some very, very high expectations. Thank you so much, all of you at CSG. We've appreciated those expectations, and part of why we decided to apply for another JMHCP grant is because we had a partnership commitment and a partnership commitment to get some of this work done, but it takes some systemic organization to really walk through your challenges and figure out what you need to do to address those challenges. We know that applying for a JMHCP grant, we are not looking at funding to just expand a program or to get staffing or to kind of do what we need to do. We understand that BJA funding is really about capacity building. Capacity building funds that we use to significantly catapult our local processes beyond their current level of effectiveness. So what we wanted was we wanted to explore opportunities for training, to get some really good technical assistance, and to pilot some new things that we were considering, most specifically a law enforcement assisted diversion grant. In our first JMHCP planning process, we'd focused a lot of our work on intercept levels 2, 3, 4, and 5. But looking around, we realized that we had some early intervention prevention work to do. So in our second JMHCP grant application, that's why we focused on police mental health collaboration, and our planning work is primarily focused at intercept 0 and at intercept 1 at the moment. So looking around and looking at these solicitations, they're long and they are complex. So I want to remind you that how you choose which JMHCP grant category to apply for is a very important decision. I recommend that before you make a decision, meet with stakeholders, perhaps do a brief sequential intercept mapping exercise just on your own to see where the largest kind of programming and systemic coordination gaps occur. Make sure to really read the solicitation. If you have not done a comprehensive formal planning process, you may really not be ready for Category 3 funds yet, and I do recommend looking at Category 1 and Category 2 funds that include a planning process. As the previous previous speaker, Tiffany, was saying, do not underestimate the value of this planning process. It is very systemic, it is very organized, and it pushes you to think about things in ways that is much farther beyond an initial kind of brainstorming, hey, we really ought to look at these things. It takes a very deep dive into things, and it gets at the minute details. What did you need, what did we need in order to get this application ready for submission? I think the biggest thing that we needed was around the leadership buy-in and understanding of our funding purposes. I think in many ways when we start looking at these opportunities, we go straight to the dollar signs and say, what can we get and what can we do? Again, JMHCP funding is really has been most effective for us around helping us think about broad-scale systems change, how we can catapult to another level of service delivery, how we can tie together programs and services. Make sure you have some of your details all organized. I'm just going to say the basics. Make sure you have your DUNS number. Make sure you've gotten into grants.gov. Make sure you know your data ahead of time. You know the incidence of serious mental illnesses in your community, in the correctional population, in the population of those touched by law enforcement. Having that data is an essential part of your grant response. And make sure you can document why you are focusing on one or the other areas. Don't be afraid to talk about both your successes and your challenges. As you're putting together an application, again, these applications do take a lot of work. We ended up meeting weekly as a planning team to confirm our approach, our need, and our commitment. We did, as I said, our own little sequential intercept mapping process to plan our approach. We were already a stepping up initiative county. If you are not, I do recommend you looking at those federal resources. We found that the 4 outcome measures around reducing recidivism, et cetera, time in jail, are very helpful things to guide our thought processing to look around at some of those national best practices and make sure that you can align how your community is either meeting some of those best practices, thoughts, or expectations, or how you want to be able to meet some of those best practices, thoughts, or expectations. And I also want to speak about what has been helpful since we have started. So the first part I was just talking about, why we decided to apply, what it took to get into the application. I also want to talk a little bit about what we have been doing and what has been helpful. So we have undergone a community program planning process very similar, I think, to what Tiffany was describing in terms of we have an interagency work group and we have a project coordinator and we're meeting on a regular basis, and we broke into work groups to look at some of our problem areas. We also had some kind of multi-day planning processes. We had a shared safety meeting where we did a resource inventory with dozens and dozens of community-based organizations and partners and stakeholders to help us really map the resources in the community. And then we just completed a 2-day formal sequential intercept mapping process, which even though we had kind of walked into this thinking we wanted to focus on intercept 1 for law enforcement assisted diversion, was really, really, really helpful, because anytime you think about one component on that sequential intercept map, you have to think about what comes before and after. You can't just look at one in isolation. That's not how individuals experience the system. They experience all of those different intercept points as places where they come in contact with the criminal justice system, and they want all those places to work. And I think what's been most helpful in the JMHCP grant is that we have the capacity to really do this work, to do it as a community, to meet on a regular basis, to get input from community partners, from families and people with lived experience, and to have that input heard by not just our police chiefs and our mental health director, but our community resource officers, the bike officers, line staff in our mental health department, and that's been really helpful. We have also really appreciated the technical assistance that has come with receiving a JMHCP grant award. We were able to do some site visits. The webinars are fantastic, and really the contact with other grantees is one of the most helpful things that we have in terms of being a JMHCP award recipient. There is so much innovative work around the country that is going on, and it's really, really helpful to hear what others are doing, and definitely making connections and getting tips. And we have not been shy in reaching out to our partners around the country and asking for copies of tools and policies and procedures, and plagiarizing those to meet our own needs. And it's been very effective and very helpful for us to have those resources and partnerships with other jurisdictions that perhaps we never would have been in contact with before. So I think this grant has really helped improve our work really across the system of care for criminal justice and behavioral health systems. It really allowed us to do this formal planning process and meeting on a regular basis, and we have gotten more and more support as a result of that. So as we start looking into some of the issues and if you could just go back to that previous slide on the things that we're supposed to do. Can someone move that slide back? Great. So we think, oh, okay, we're doing some of these things and we're doing some of these things well. But then as you go into it, you're like, oh, here's this gap in this protocol. We need to fix this. Yeah, we kind of have some de-escalation training, but we don't have 40-hour crisis intervention training for all of our dispatch officers. How do we put those in place? So as you go through the planning process strategically, you realize both how much you have, but also where your targeted gaps are. And one of the things that happened when the leaders from various departments sat down on a regular basis and were able to talk about these very systemic kinds of gaps, what we found is that it was less about having enough staff to do the work, and we didn't necessarily need that many more positions. What we needed was better coordination and policies and procedures and training for the staff to work together. So now we are developing new police and mental health coordination policies. We're developing referral policies, consent for information sharing policies. We're developing new strategies for how we triage and refer individuals into some intensive services, and how to decide who qualifies for services, who needs to go into a higher level of intervention, and who may not qualify for the kinds of intensive services that we're talking about for people with serious mental illnesses and co-occurring mental health and substance use disorders. So that's been really, really helpful in getting us on the same page. And in fact, one of the things that happened was that each of the lead departments all committed more funding to implement this in terms of existing staff time and resources. So our district attorney has volunteered to kind of lead ongoing efforts for our initiatives, to track information, to have several of the DA staff to be in charge of kind of managing the program and tracking outcomes. Our police chief has made a commitment to assigning officers to a special task force to work in a pilot area where we're going to see if new kinds of outreach, engagement, and interventions work. They're going to get some special training and some new tools in their tool belt so that they can spend more time with individuals with serious mental illnesses on contact and not feel like they have to wrap things up and make an arrest or get someone, we call it a 5150, an involuntary detention and over to a psychiatric health facility, but maybe spend much more time doing de-escalation and calling in some on-site resources to do a transition to mental health services. And then our mental health department has made a commitment to staff up and work much more closely with the police department. They're now meeting with the special law enforcement team on a daily basis every morning and working through plans on how to reach out to a special target population of high-risk individuals, frequent offenders with serious mental illnesses that are doing mostly nonviolent, non-serious offenses like public safety, nuisance crimes, petty theft, petty vandalism, things like that, and how to get them in, work together to get them into treatment. So it's been really fantastic. Our Board of Supervisors, our Mayor, and our City Council is thrilled that we are doing these collaborations, so we have a lot of support from them. We still have a ton more work to do. We're formalizing joint policies and procedures, but we still have a lot of work ahead of us. We have to come up with a whole new training plan. There's all kinds of trainings we need to now put in place that we realize are missing. And once we kind of get our formalize our joint policies and procedures, come up with our training plan, formalize our staffing commitments and resources, then those all need to go into an MOU. We have the outlines of that, but of course we still need to do them.
Thank you so much. Thank you so much for all that information. I'm going to have to turn it back over to Maria to go on to the next grant category. We really appreciate it.
Absolutely.
Casey, thanks again. Lots of really good planning information, so helpful. It's clearly grown a very comprehensive program in San Joaquin, and I know it'll be very helpful to our applicants. So we're going to finally get into the last category, Category 3, Implementation and Expansion. And want to say that this overall goal for this category is to increase public safety and reduce recidivism among high-risk people with mental illness and co-occurring mental illness and substance abuse. This grant category, Category 3 grant, can support initiatives across the criminal justice system. It's our broadest category, and it can include programs under law enforcement, prosecution, court-based programming, corrections, parole, and probation initiatives. Grant funds may be used to support a combination of the allowable use categories, which I'll describe in the next few slides. They'll be concentrated in one specific category, Category 3 grant phases. Next slide, please. Like Category 1, the Category 3 grants have two phases. Phase 1 is a planning phase where awardees receive technical assistance from BJA's National Training and Technical Assistance Provider and follow and document the steps laid out in the Category 3 Planning and Implementation Guide. This is done after receiving a grant award and within 6 months of receiving final approval of the project's budget from OJP. During Phase 1, up to $150,000 can be spent. Phase 2 comes after completion and BJA approval of the Planning and Implementation Guide. This is where the remaining grant funds may be used to support allowable activities. So speaking of allowable activities, we have a chart here that shows behavioral health diversion strategies. And as I mentioned, grant funds may be used to support a combination of the allowable use categories. This graphic shows some of the options for pre-booking and post-booking interventions that can be funded under JMHCP. From law enforcement initial contact to jail, to courts, to pretrial services, to specialty courts, to reentry from jail or prison, or probation and parole initiatives. We've seen a lot of innovation from applicant and grantees over the years and how they can create system change through using JMHCP grant funds. So looking at investing in the full range of system improvements, sites can invest in a full range of system improvements or be concentrated on one specific category. This graphic shows that at any point in the criminal justice system, it is important to connect people with mental illnesses or co-occurring substance abuse with the community-based continuum of treatment available along with support services and housing. Category 3 deliverables in Phase 3. Training for criminal justice, mental health, and substance abuse treatment personnel. Training programs that offer specialized and comprehensive training for law enforcement personnel through state academies and local departments in procedures to identify and respond appropriately to incidents which individuals with mental illness are involved, such as crisis intervention team training or other PMHC model strategies. Training staff, including supervising officers, to provide highly specialized and skilled and evidence-based services targeting mental health and criminogenic needs. Cross-system training programs for law enforcement, corrections-based staff, court personnel, community supervision personnel, and community-based mental health and substance abuse provider. Training programs should be designed to facilitate collaboration and enhance competency of personnel working with individuals with mental illness in the criminal justice system. Training areas may include behavioral health and criminogenic risk and needs, case management, trauma-informed care, crisis responses, and integrated treatment and supervision strategies. Training for judges and prosecutors on recognizing indications of mental illness, being familiar with different screening and assessment options and dispositional options that are available to create linkages to community-based treatment and supervision. Mental illness or co-occurring mental illness substance abuse in order to appropriately inform decision-making and prioritize limited resources and identify needed capacity. A criminogenic risk needs assessment must be completed for all program participants. Appropriate risk need assessments in conjunction with behavioral health needs assessments inform the types of services to provide and the intensity of the supervision for this population. Specialized caseloads. These are for people on community supervision with more significant mental health needs or higher risk of reoffending. For law enforcement, this could include implementing or enhancing a crisis or receiving center for individuals in custody of law enforcement to assess the suicide risk and mental illness or co-occurring mental illness substance abuse treatment needs and refer to or provide appropriate evaluation of treatment services. Another use is case management and service coordination, including evidence-based treatment models that are tailored to meet the assessed mental health, substance abuse, and criminogenic needs of the target population. Case management and service coordination housed inside police agencies or evidence-based of promising mental health treatment practices shown to improve clinical outcomes for people with serious mental illness. Information sharing is another area that's an allowable cost within this category. Within and across information sharing within and across criminal justice and behavioral health treatment agencies to make eligible determinations and ensure direct connections to treatment services in the community. For law enforcement, this could include developing or enhancing computerized information systems to provide timely information to law enforcement and other criminal justice system personnel to improve the response to incidents involving people with mental illness and co-occurring mental illness and substance abuse, and which fosters the systemic analysis of incidents involving people with mental illness, co-occurring mental illness and substance abuse. Thank you. Next slide, please. Priority considerations. There are 3 priority considerations. One is the use of criminogenic and violent risk assessments to identify and prioritize treatment and case management services for individuals at risk for committing future violence. The majority of people with mental illnesses are not violent and do not commit crime, although research does suggest that some people under the influence of drugs are more likely to be violent whether or not they have a mental illness. BJA will prioritize applications which include the use of risk assessment to identify individuals with mental illness who also show significant risk or propensity for future violence, and which propose to connect those individuals to mental health treatment and intensive case management services. The second priority consideration is program evaluation, and program evaluation is critical to the effectiveness and utility of JMHCP programs, as evaluation not only determines which programs are most effective for the populations, but also contributes towards the expansion of knowledge base of what programs have the highest likelihood for success in lowering recidivism and improving public health outcomes. BJA strongly urges applicants to consider a partnership with a local research organization or university that can objectively assist with data collection, performance measurement, and local evaluation. And the third priority consideration is the provision of services of female offenders. Consistent with the Mentally Ill Offender Treatment and Crime Reduction, Reauthorization and Improvement Act, known as MIOCRA, priority will be given to applications that promote effective strategies for identification and treatment of female offenders with mental illness and co-occurring mental illness and substance abuse. On to the target population, Category 3. There are some additional pieces in the solicitation about the target population for Category 3 that we want to bring to your attention. Current research points towards the risk-needs responsivity, known as R&R model, for how corrections and judicial authorities should be identifying and prioritizing individuals who receive appropriate interventions. When prioritizing individuals with behavioral health needs in the justice system for scarce programming and treatment resources, priority should be given to those at higher risk for recidivism and higher criminogenic need as determined by a validated actuarial risk and needs assessment. Next, we have Brooke O'Brien, who is the Director of Court Services for the 6th Judicial District Court in Nevada. She is the lead for FY17 JMHCP Category 3 grantee, Humboldt County, Nevada. Brooke is going to tell you more about the ways their team is using the Category 3 implementation and expansion grant funds. Brooke, I hand it over to you.
Thank you. So, hi everyone. Yes, my name is Brooke. I am the Director of Court Services here for Nevada's 6th Judicial District. Our district is located in Winnemucca, Nevada. For those of you not familiar with Winnemucca, we are an Humboldt County. We are an extremely rural jurisdiction. We are about 166 miles from the nearest urban setting, and our neighboring towns are still about 80 miles away. Our county is about the size of the state of New Jersey, and our county has a population of about 18,000. So while we're geographically very large, we are positioned very far away from resources, and we have a small population. So with that, we found that we had some very unique challenges when we started to look at the work that we are considering doing. Just to name a few, we have very few Medicaid services that we can access for our clients, and we have a lot of community partners that are working to improve this. But at the time of application, we had 2 mental health providers in the entire county providing mental health services to 3 Nevada counties, all of which are not equal in size, but equally large and geographically dispersed. Furthermore, we didn't have any Medicaid providers to support substance abuse treatment. On top of that, 58% of our state doesn't have any access to in-person psychiatric care. We are right in the center of that region that doesn't have access. The largest mental health facility in our state it's a prison. It's the Northern Nevada Correctional Facility, which has 1,500 inmates who have diagnosed mental illness. And then on top of that, we continue to see the same people cycling through our system. And so when we looked at it from a court perspective on how we can partner with all of our community and state partners to try and improve the work we're doing, we really had a unique lens. So we had been watching this funding announcement for actually several years. We never really felt like we were in a good position to begin the work. And so last year when it was released, our community had already begun the process over the prior years to try and work toward a solution. And so through the course of those years, some of the work we had hosted was we supported a community roundtable and summit where we initially were really looking at some of our suicide prevention needs, because our county had one of the highest death by suicide rates in the country. And we started to look at formulating behavioral health task forces that were, truthfully, we weren't looking at our work from the lens of the strategic intercept model, although all of the work we were doing fit into that framework. And so over the last 2 years, we had really done a lot to bring the right stakeholders to the table, and so that we could start to look at where each of us could maybe start to make a difference. So in looking at our regional challenges and our community's progress over the years, last year we decided it was time to apply for the PMHC grant. So what we did start to do at that point was look at our progress through that strategic intercept lens, and it really started to, quite honestly, add some vocabulary and a more focused vision for the work we were doing throughout the community. As a court, we identified 2 places where we felt we could really expand the community's work, and for us, under this Category 3 funding, we felt like it was expanding our existing mental health court and implementing a pretrial release program. At that point, we had several operating adult specialty courts. Mental health court was always an unfunded program, and so given what I told you about our region, the type of people that we could accept into our program were people who had health insurance to access care, or they had the resources from their family members to travel the 166 miles for regular appointments. And so when we looked at our work, we thought by increasing funding, perhaps we could start to bring some of those resources into the community so that we could serve a higher number of those seriously mentally ill and individuals through our court system. Additionally, we really started to question how we could really prevent people from coming through the court system in the first place. And so in addition to our mental health court component, we had a second pathway where we proposed to implement a pretrial release program. At the time of our application, we did not have an existing program, and even today we're still working through the planning and implementation guide, and so that program's not 100% off the ground yet. But we definitely saw these as places where we could focus on Intercept 2 and 3 and really provide some court-based interventions. So now we're currently in year 1 of funding, and we are working through the planning and implementation guide. Truthfully, there has been a learning curve. through these first few months, there have been some process steps that we weren't aware of. CSG has been an amazing partner to help us through that process, help us figure out who we need to be contacting and anticipated timelines and kind of what's normal, what's not normal. And we continue to work through that, and it's really helped to give our project some additional focus, and it's really helping to expand the work throughout the community. You know, when we do look at the work throughout our region, we really see this project as helping us to break down some silos. I think going back to that concept of the strategic intercept model and giving our stakeholders some shared vocabulary and a unified vision, this has really helped us all to work in the same direction. You know, we don't really have any clear outcomes that we can share at this point because we're 6 months in, but our goals are to focus on these post-booking court-based interventions that we do have control over. And so what we're hoping to achieve are increased collaboration across the community. We are very focused on using a risk-need responsivity tool to identify people at earlier intercept points. And we're really hoping to increase front-end diversion. We want to be providing people access to care prior to their need to get to the district court level, which is, you know, it's going to take a lot of work and planning on a community level for us to get there, but that is a huge component of our project, and we're really excited to get through the planning and implementation guide so that we can begin our work. Thank you.
Thanks so much, Brooke. We appreciate that explanation, a great feel for one of the options and a way you can use the grant funding to do multiple things. So I am going to turn it over to Nikisha Love, who's going to talk about some of the budget and review criteria. We're actually going to shorten this section, so once Nikisha goes over the really important budget information, we're going to then be able to switch to the questions and answers. If you have any questions, please use your chat box to chat it in, and we will take as many as we can.
Hello, thank you, Sarah. I'm going to talk to you about some budget information. Applicants for Category 1 and 3 must explain their inability to fund the collaboration program adequately without federal assistance, specify how the federal support will be used to supplement and not supplant state, local, Indian tribe, or tribal organizations' sources of funding that would otherwise be available, including billing third-party resources for services already covered, and outline plans for obtaining necessary support to continue the proposed collaboration program following federal support. Next slide. Okay, thank you. For all applicants, it includes the amount and source of matching funding. Category 1 and 3 applicants must set aside an adequate amount of funding to implement a data collection plan. Category 1 applicants should structure their budget to accommodate access to a portion of the budget up to $100,000 of the total grant award in order to complete and submit a required portion of the planning and implementation guide within 8 months of receiving final OJP approval of the project budget. Category 3 applicants should structure their budgets to accommodate access to a portion of the budget, up to $150,000 of the total grant award in order to complete and submit a required planning and implementation guide within 6 months of receiving final OJP approval of the project budget. Program budget approval in coordination with a technical assistance coordinator are required to complete and submit a planning and implementation guide. Cost sharing or matching requirements. Cash or in-kind is one of the places we receive the most questions on. Federal funds awarded under this solicitation may not cover more than 80% of the total cost of the project. an applicant must identify the source of the 20% non-federal portion of the total project cost and how it will use match funds. If a successful applicant's proposal match exceeds the required match amount and OJP approves the budget, the total match amount incorporated into the approved budget becomes mandatory and subject to audit. Indian tribes and tribal organizations that otherwise are eligible for an award may be able to apply certain types of may be required to apply certain types of funds received from the federal government. Examples: certain funds received under an Indian self-determination contract to satisfy all or part of a required non-federal match. Okay.
Thank you so much, Nikisha. That is such important information and something we always receive the most questions about. Now we're going to actually hand it over to Nikki to ask some of those questions we've received on the webinar thus far.
Okay, you're welcome. Thank you, Sarah.
Thank you, Sarah. Welcome, everyone. So we have a few questions here, and I'm just going to ask them, and I will just direct to the person who I think is most suitable for this. Maria, this question is for you. Can prisons also apply for Category 1?
So the Category 1 is basically the county collaborative. I would have to see the project. I would, if they could write me offline, that would be helpful. I want to say yes.
Okay, great. Just to add as well, we do have 2 prison grantees that have applied for Category 3. So for whomever asked that question, please note that we do have prison grantees in the Category 3. Thank you, Maria.
Yes, thank you.
Another question. We currently have a JMACP grant that ends September 30, 2019, and are considering applying for the current JMACP grant in the expansion area to build on current accomplishments and momentum in pretrial detention. This would mean 9 months of overlap between the 2 grants. Is this allowed, or is this a good idea? Maria, for you.
So, sounds like they have two grants. If there are 2 separate funding sources, that's fine.
Okay.
Did I answer the question?
So they currently have a grant, JMACP grant, and it ends in 2019, and they basically want to know if they can apply for this one as well. There will be a 9-month overlap, but can they have 2 JMACP grants in the same jurisdiction?
Yes.
Great. Thank you. Another question, may a jurisdiction apply for a grant in more than 1 category? Would the fact of multiple applications be viewed unfavorably?
Yes, they can apply in 2 different categories. I wouldn't say that it would be looked upon unfavorably. It would just depend on the quality of the application and how they scored in the peer review process.
Great. Thank you so much. We have a question here. Have any federally recognized tribes been awarded a JMACP grant? If so, can you share which tribes? Sarah, let me ask you to respond to that.
Sure, thank you. There have been many awards to tribal nations throughout the years. We can via email share a list of the full tribes that have been awarded in the past. But yes, certainly encourage and look forward to tribal nations applicants, and we can connect offline with the exact list.
Great, thank you. This question for Nikisha. Can the applicant's cost sharing be in kind only? Are indirect costs allowed? And if so, can they count as an in-kind match?
Yes, but it also depends on what they will be using the actual indirect cost for.
Okay. Thank you, Nikisha.
Mm-hmm.
This one for Maria. Can Category 3 support a request for a co-responder model for high risk and high utilizers at Intercept 1 that includes law enforcement, fire and rescue, EMT, emergency department, and mental health staff?
Yes, absolutely.
Great. Thank you, Maria. I saw that question and I thought absolutely this would be a perfect collaboration. So please do, I encourage you to apply for that.
Sounds wonderful.
Question to Maria, is it possible to access sample proposals for each category?
We could provide the abstract with some redacted, personal information if there's any in there. We could provide an abstract. They are supposed to be posted on our website. I don't keep track of the regular posting. I'd have to check it, but I would encourage you to go to our website and look for past awards. Thank you, Maria. This is a question we got earlier, but I will ask it now, so in case anyone else has this question. On page 17, under the heading 3, Program Narrative, the grant announcement states, the program narrative must respond to the solicitation and the selection criteria 1 to 5 in the order given. However, I cannot find selection criteria items 1 to 5 within the document. Can you please explain what they're referring to? And Maria, I'll just go ahead and respond to this. This is the question we had gotten earlier. So for those who are a little confused about the language, this is referring to the review criteria that's on page 32 and the 5 items that are there. Another question for Maria. May a jurisdiction apply for a grant in more than one category? Would the fact of multiple applications be viewed unfavorably? So similar to the other question, there's nothing to prohibit a jurisdiction or 2 jurisdictions even in the same state to apply to 2 different categories. Again, it goes back to the quality of the application and how they fall out within the scoring and through the peer review process. Thank you, Maria. Being mindful of time, we're going to end the question and answer at this time. If you do have questions, we encourage you to send us an email, and you will see our contact information at the end. Sarah, back to you.
Thanks so much, Nikki. And just to go over some other key information, the deadline for the applications for this grant program is May 29th, 2018, and on the slide deck and the posting for this recording, we will have the information available as well. It's also in the solicitation itself, which you all probably reviewed if you're on this webinar. You can also, there is technical assistance for applications available at this available through support at grants.gov, as well as the 1-800 number below. Here's some additional resources to follow up information which was provided on the webinar, and then you'll see our contact information. So if you have additional questions, email one of us and we'll make sure that we can connect you with the right person to respond. So thank you to everyone who joined, and thank you to the speakers of this webinar. We really appreciate it, and we're looking forward to a great pool of JMHCP applicants this year. Have a great afternoon.